Hello dear student, welcome in Pharmaceutical Chemistry 2. Today we are going to deal with antibiotic. This is part 5. Myself Mrs. Urmila Ravindra Gauli, MPharm in Quality Assurance and lecturer in KK Institute of Pharmacy, Sandori, Nasik. Learning outcomes. After listening, student will able to learn to name non-lactum antibiotics according to IUPAC system, to understand the chemistry of amino glycoside antibiotic, to recognize the different non-lactum antibiotic on the basis of structure, chemical name, physical property, uses and official preparations, to recognize the different non-lactum antibiotic on the basis of their uses, official preparation with the brand name. Let's start with non-lactum antibiotic. Non-lactum antibiotic, amino glycoside antibiotic. They are so named because their structure consists of amino sugar linked glycosidically. The clinically important amino glycoside antibiotics are streptomycin, neomycin, gentamicin, paromomycin. They are highly substituted 1,3-diamino cyclohexane ring. Hence, they are strong basic compound. Although they are classified as broad-spectrum antibiotic, they are mainly used in the treatment of serious systemic infection caused by aerobic gram-positive bacilli. Let's start with individual drug for their monograph. First drug is neomycin. It is amino glycoside antibiotic produced by Streptomycin fradii. It is a broad-spectrum antibiotic. It is a mixture of 3 components, that is neomycin A, B and C. Properties. Its sulfate salt is white or yellowish white powder. It is hygroscopic. It is freely soluble in water but very slightly soluble in alcohol. Chemical property. The solutions of substance in pyridine when heated on water bath with ninhydrin between 65 degrees Celsius to 70 degrees Celsius for 10 minutes, a deep violet color is produced. Uses. It is a broad-spectrum antibiotic and hence it is used to treat staphylococci infection of skin and eyes, gastrointestinal tract infection on oral administration, in conjugation with other antibiotic. It is used to prevent infection in neutropenic patient. It is used for the patient suffering from hepatic coma to suppress ammonia forming bacteria in gastrointestinal tract. Pharmaceutical formulation. It is available in the form of neomycin cream, hydrocortisone and neomycin cream, hydrocortisone and neomycin ear drop, neomycin eye drop, neomycin and hydrocortisone eye drop, neomycin eye ointment, neomycin, bacitracin and polymyxin eye drop. Brand name Dixaber N, Dixacort N, Nebasaf and Neosporin. Next drug is gentamicin. It is an amino glycoside antibiotic. It is a mixture of gentamicin C1, gentamicin C2 and gentamicin 1A. Some sample may contain gentamicin C2A and C2B in sufficient quantity. It is produced by Micromonospora purpurea and hence the name ends with mycin. Physical property. Its sulfate salt is white to cream colored powder. It is soluble in water and practically insoluble in chloroform. Stability and storage. Store in tightly closed container in a cool place. Uses. It is a broad spectrum antibiotic. It is used to treat septicemia including neonatal sepsis, other severe systemic infection due to sensitive gram-positive and gram-negative bacteria. It is also used for prophylaxis and the treatment of endocarditis. It has been used for prophylaxis of surgical infection. It is given in combination with other antibiotic to delay the development of resistance. Pharmaceutical formulation. It is available in the form of gentamicin injection, gentamicin cream, gentamicin ointment and gentamicin eye drop. Brand name gentamicin, G-mycin and Gentapar. Now next drug is tetracycline. Chemistry. It is a 7-chloro-tetracycline or aureomycin was the first member amongst tetracycline. It was introduced in 1947, obtained from Streptomycin aureofaciae. 2 years oxytetracycline, that means tetramycin produced by Streptomycin rhamnosus was introduced. After knowing the structure of chlorotetracycline, tetracycline acromycin synthesized from it. Tetracycline are octahydronaphthacin derivative. They are broad spectrum antibiotic. Amongst this class, 8 compounds are introduced in the medicine. Physical property. It is a yellow crystalline powder. It is odorless and has a bitter taste. It is very slightly soluble in water and soluble in dilute acids. It is soluble in solutions of hydroxide with decomposition. Its 1% suspension in water has a pH of 3.5 to 5.5 and it is levorotatory. At a pH between 4 to 8, it undergoes epimerization at C4, that is, inverse configuration at C4 occurs. The compound thus obtained has an antimicrobial activity. When tetracycline is treated with strong acids, dehydration and aromatization occurs, giving anhydrotetracycline. In presence of strong alkali, rearrangement and cleavage of the bond between 11 and 11A occurs, giving isotetracycline, a lactone which is inactive. Stability and storage. It darkens in strong sunlight and in presence of moisture. Hence it is stored in tightly closed, light-resistant container. If intended for parenteral preparation, the container should be sterile and sealed so as to exclude microorganisms. The label on the container should bear not to be injected if the preparation is parenteral administration. Uses. It has wide spectrum of activity and therefore it is used to treat chronic bronchitis, urinary tract infection, syphilis, gonorrhea, rat bite fever in penicillin hypersensitive patient. Then acne vulgaris. Next use, in conjunction with streptomycin, it is used to treat plague. In combination, fluid and electrolyte replenisher, it is used to treat with cholera. In conjunction with quinine, it is used to management of malaria resistant to chloroquine. In combination with amebicide, it is used to treat amoebic dysentery. Topically, it is used to treat chlamydia infection of eye, but in this case systemic treatment is also needed. Pharmaceutical formulation. Tetracycline is available in the form of tetracycline capsule, tetracycline injection, tetracycline tablet, eye drop, eye ointment, tetracycline and procaine injection, tetracycline intravenous infusion. Brand names acromycin, enterocycline and cadicycline. Thank you dear student for attending the session. Thank you.